Bismillahirrahmanirrahim. In the name of Allah, the most gracious, the most merciful. I am Dr. Amna Khan. I'll be giving critical appraisal under the supervision of my respectable professor, Dr. Saira Afzal. The article that I'll be appraising today has the title, Prioritizing Non-Communicable Diseases in the Post-Pandemic Era, based on a comprehensive analysis of the GBD 2019 from 1990 to 2019. We will be using Gather checklist for today's critical appraisal. Here is the checklist. Title. So the title is Prioritizing Non-Communicable Diseases in the Post-Pandemic Era based on a comprehensive analysis of the GBD 2019 from 1990 to 2019. So there is identification as a global burden of disease in the title. This study aimed to assess the burden of communicable diseases and non-communicable diseases globally, regionally, and nationally from 1990 to 2019, and propose global strategies to transform the public health policy using data from the Global Burden of Disease 2019. We analyzed communicable diseases and non-communicable diseases across various factors such as sex, age, year, and location, and evaluate the temporal trends of these diseases with joint point analysis. We also examine the differences between regions based on their socio-demographic index. In 2019, there were 78,62,907, 95% uncertainty interval, 71,83,475 to 86 lakh 54,104 deaths from communicable diseases, and 42 lakhs 34,124 deaths from the non-communicable recorded worldwide. The low socio-demographic index region had markedly high age, standardized death, and daily rates of the communicable diseases. Although the age standardized indices rate of communicable diseases has decreased in about half of the region since 1990, non-communicable diseases have been on the rise in the most regions. Over the past 30 years, the global burden of the communicable diseases has decreased significantly, while the burden of the non-communicable diseases has aggrandized to an extent. In the post-pandemic era, effective interventions and cooperation among countries should be promoted to allocate medical resources more reasonably and improve healthcare for non-communicable disease patients. So that was the abstract. So in the article, the abstract's heading was not mentioned. There was no structured summary. The trial design isn't mentioned in the abstract. Methods were not mentioned. They've given the results, but they're not that clear here. Conclusion is not that clear, and the keywords are not mentioned. Introduction. As the COVID-19 pandemic continues to range around the world, the death toll is rising due to the spread of novel coronavirus and its variants. It has been more than 3 years since the emergence of COVID-19, and infection prevention and control for COVID-19 have consumed substantially medical resources in various countries, diverting attention from non-communicable diseases and resulting in alarming consequences. According to WHO, as of January 2023, the number of deaths reported due to COVID-19 has surpassed 660 million. In this study, our aim was to comprehensively analyze the global burden and trends of communicable diseases and non-communicable diseases from 1990 to 2019, explore the double burden of communicable diseases and non-communicable diseases during the epidemiological transition, and investigate variations in disease burden among different countries, age groups, and genders, with the goal of informing health system in prioritizing prevention, monitoring, and disease management efforts. Furthermore, we examine the current post-pandemic era and proposed corresponding strategies, offering valuable insights for policymakers, public health practitioners, and researchers. So, as far as introduction is concerned, the scientific background is given. Rationale is given, but it's not that clear. Specific heading of the introduction was not mentioned in the article. Methods. So the overview is the GBD 2019 report provide estimate for 369 diseases and injuries and risk factors, and 87 risk factors across 204 countries and regions. It includes a wide range of models for disease and injury outcomes. studies the cause of disease, assemble models, spatiotemporal, Gaussian process regression, and Bayesian meta-regression tool. So to collect data on communicable diseases and non-communicable disease from 1990 to 2019, we used the global burden disease results tool and considered factors such as location, age, sex, and gender. The burden of the disease in this paper was made by using 4 indicators from the GBD, incidence, prevalence, death, and daily, with all the standardized age and age-specific rates, including 95% uncertainty interval data available. The study design used in this research was ecological nature. Joint point regression analysis. The joint point regression model is a linear statistical tool that helps assess trends in the burden of communicable diseases and non-communicable diseases over time. In this study, we employed joint point regression analysis, version 4.9, April 2022, to determine the estimated annual percentage change and quantify the trend of the disease from 1990 to 2019. We use the term increasing to describe trends when both the estimated APC and the lower limit of the 95% uncertainty interval were greater than 0. Conversely, we use the term reduced to describe the trends when both the estimated APC and the upper limit of the 95% uncertainty interval were less than 0. The article utilized RStudio and an integrated developmental environment for the R program Ming language version. So for the methodology, it describes how the data were identified and how the data were accessed. The specific inclusion criteria is not given. They have not mentioned the exclusion criteria. They provide they have not given the information on all the included data sources and their main characteristics. It does not provide a conceptual overview of the it provides a conceptual overview of the data analysis method. It doesn't provide a detailed description of all the steps of analysis, including mathematical formula. It provides the results of an evaluation of the model performance if done, as well as the results of any relevant sensitivity analysis. Describe methods for calculating uncertainty of the estimates. Results. So they have mentioned the global burden of communicable diseases and the global burden of the non-communicable diseases. They have given the results in the form of the figures where they have mentioned total number of the cases and the new cases of communicable diseases, the prevalent cases, the incidence, death, and daily rates of communicable diseases were higher in men than women, while the prevalence was slightly higher in women. Furthermore, the more than 20-year age group had the highest number of incidence cases across all the age groups, which made relatively stable. And as far as the global burden of non-communicable disease is concerned, they have they have given the findings in the form of the figures about the total number of new cases, the deaths, and the prevalent cases. And in the term of age groups, the highest number of the incident cases were observed in the in less than 20 years age group, whereas the lowest was observed in the more than 80-year age group. Overall, there was an upward trend. So here you can see in this table, they have given the global burden of communicable disease in 2019. They have mentioned the regional and the national burden of communicable diseases, regional and national burden of the non-communicable diseases, communicable diseases and the social demographic index, and the non-communicable disease and the social demographic index. You can see the graphs here. They have given the results in the form of the graphs, the global trends for the AIDS and rise rates, discussion. Despite improvements in global health and healthcare access, there remain a significant risk of communicable disease outbreaks. Examples include the severe acute respiratory syndrome coronavirus outbreak in 2003, the Middle East respiratory syndrome coronavirus outbreak in 2012, and the ongoing pandemic of COVID-19. However, the burden of non-communicable disease should not be underestimated. According to the 2019 global health estimates, ischemic heart disease, stroke, and chronic obstructive pulmonary disease are the top. They are the top 3 causes of death worldwide. Our study found that in 2019 there were 26.1 billion new cases and 7.86 million deaths globally due to the communicable diseases, and 30 billion new cases and 42.03 million deaths due to non-communicable diseases. Certain regions as southern sub-Saharan Africa are faced with the challenge, a double burden of communicable disease and the non-communicable diseases. The burden of communicable and the non-communicable disease at different levels. The global burden of the disease shows that non-communicable diseases are responsible for more deaths, prevalence, and daily than the communicable disease, while the incidence of the communicable diseases is higher. Over time, the age standardized death prevalence and daily rate of the communicable disease have decreased significantly, and incidence has also shown a declining trend, although it has demonstrated sign of increasing in recent years. Age standardized death and daily rate for non-communicable communicable disease have also decreased, consistent with previous study, but the incidence and the prevalence have fluctuated and kept increasing in the recent years. When focusing on the absolute values due to population growth, the number of incident and the prevalent cases of the both communicable disease and the non-communicable disease has increased each year, while the number of the deaths and the dailies due to the communicable disease has decreased each year, and the number of deaths and dailies due to non-communicable disease has increased each year, which is consistent with the research findings of the Christopher et al. In 2019. So here they have, in this section, they have mentioned the comparison of the study with the various studies, and they have given their results in the form of the comparison and the contrast with the different studies. Here are the forest plot. They have mentioned the regional age and rise incident rates of the communicable diseases in 2019, and regional age and rise incident rates of the non-communicable disease in 2019, and their sex-specific percentages from 1990 to the 2019. They have given the area maps as well. You can see here national age and rise rates and of the communicable disease and the non-communicable disease in 2019. They have given the scattered plots as well. And they have here you can see they have given the graphs for the trends for age and rise rates. Global and regional communicable diseases ranked by the total number of deaths in 2019. And here are the scattered graphs mentioned. Conclusions. The COVID-19 pandemic has created unprecedented challenges to the global healthcare system, especially in the managing non-communicable diseases. It is essential to develop resilient healthcare system capable of treating non-communicable diseases, expanding diagnostic capacity, and prioritizing the introduction of vaccines and intervention to reduce disease-related morbidity and mortality. Additionally, addressing underlying causes and promoting primary prevention of non-communicable diseases, as well as monitoring social challenges and inequalities exhibited by COVID-19 are also critical steps towards improving global health outcomes. Now, to appraise the results and discussions, does define the indicator population, including age, sex, and geographic entities, and the time period for which estimates were made. The list of the funding sources for the work are not given here. It provides published estimates in a file format for which data can be easily extracted. It interprets results in the light of existing evidence. It doesn't discuss the limitation of the estimates, include discussing of any modeling assumption or data limitations that affect adoption of the estimates. Does not provide all data inputs in a file format from which data can be efficiently extracted. It does not identify and describe any categories of the input data that have potentially important biases. It reports a quantitative measure of the uncertainty of the estimates. Strengths of the study. Title is self-explanatory with the type of study. Methodology is relatively explained in a better way. Graphical representation of the results presented. Discussion includes comparison and contrast with the other studies. Area maps for the global burden disease given. They have given the forest plots and the scattered plots. Limitations. No specific heading of the introduction is mentioned. There is no specific heading of the abstract given. Abstract is not structured. Inclusion and exclusion criteria are not mentioned clearly. Data sources are not very well defined. Biases are not addressed properly. There is insufficient data in GBD hindered comprehensive analysis of common risk factors. Difficulty establishing causality with observational data. Further studies recommended for validation. Limitation of the studies are not mentioned. They have not commented about the funding of the study. So thank you so much. Here is the link on the YouTube channel. All the videos are uploaded here. You can go like and subscribe there. And thank you so much, everyone, for patiently listening to the appraisal.
Thank you very much.